Hello and welcome to our channel Nuturemite, where we provide informative videos regarding health and lifestyle. Please like, share and subscribe the channel and click on the bell icon for important notification and videos.
Let's see week 7 of pregnancy. So your baby is about the size of a blueberry. So what are the symptoms observed during week 7 of pregnancy? Frequent urination, fatigue, excessive saliva, food cravings, heartburn, gaining a few pounds, cramping and feeling thirsty. So how big is the baby? At 7 weeks of pregnant, baby is the size of a blueberry. Your embryo measures about 0.51 inches, having doubled in size last week. What about fetal development? Baby will have a more defined face with a mouth, nostrils, ears, eyes, and brain cells. They are generated at a rate of 100 per minute. The mouth, tongue, tooth burrs will also develop this week. This week, your baby's arms and legs will start developing, dividing into the hand, arm, and shoulder segments, legs, knees, and foot segments. They will still like paddles more than hands and feet. Fingers and toes will be webbed. Your baby now has kidneys that are ready to function as soon as your baby will start producing urine. Your baby is also starting to make little jerky movements this week. You won't be able to feel it right now, but an ultrasound would help you to pick up the movements. Things you should do in week 7 of pregnancy. Schedule your prenatal visit. You should schedule your first prenatal care appointment if you haven't done already. During this visit, your doctor will review your health history, determine your approximate due date, identify pregnancy risk, and gives you a physical exam. You will have your weight and blood pressure checked. Urine and blood test will be taken. A daily walk for 30 minutes or more is a moderate physical activity you can start with. Yoga is very beneficial, but do it under expert supervision. Please note, seek your doctor's approval before you start any exercise during pregnancy. What about nutrition? Increase iron intake. Due to the increased demand for blood supply, you can be at a risk of anemia. Include iron-rich foods like green leafy vegetables, nuts in your diet. Then, prenatal supplements. Take prenatal supplements as prescribed by your doctor. Eat small meals often. Eat crackers or dry cereals 15 minutes before getting up in the morning. Snip lemons or ginger. Drink lemonade or eat watermelon to relieve nausea. Don't skip meals or lie down without eating. Don't eat spicy food. So, what are the risks involved during the 7th week of pregnancy? First one being ectopic pregnancy. An ectopic pregnancy happens when the fertilized egg attaches itself outside the uterus. Then, miscarriage. During the 7th week, miscarriage could happen due to any of the following issues such as diabetes, hyperthyroidism, hypothyroidism, or uterine problems, and even unhealthy lifestyle. How to prevent leg cramps? Leg cramps are one of the symptoms that come along with a new little human which is growing in your body. Pregnancy, weight gain, swelling, changes to your circulation can make it harder for your blood to get from your legs to your heart, which can cause painful muscle cramps which makes you to wake up in the night. Below given are some tips to prevent leg cramps during pregnancy. Drink lots of water. Stretch your calf muscles throughout the day. Exercise. Avoid sitting or standing for long periods of time. Compression or support socks or leggings sometimes help improve blood flow. Drugs that should be avoided during pregnancy. First one being chloramphenicol. This is an antibiotic that's usually given in the form of infection. This drug can cause serious blood disorders and grave baby syndrome. Ciprofloxacin and levofloxacin. These two are also types of fluoroquinolone antibiotics. These drugs cause problems with baby's muscle and skeletal growth as well as joint pain and potential nerve damage in the mother. Fluoroquinolone antibiotics also increase the chances of having a miscarriage. Sulfonamides. These are a group of antibiotic medications. They are also known as sulfa drugs. They are used to kill germs and treat bacterial infections. They can cause jaundice in newborns. They can also increase the chances of having a miscarriage. Primsol. This is also a type of antibiotic. This can cause neural tube defects if consumed during pregnancy. This defect affects brain development in a developing baby. Codeine. This is prescription drug which is used to relieve pain. It can lead to withdrawal symptoms in newborns. Ibuprofen. This can cause serious problems such as miscarriage, delayed onset of labor, jaundice, and also a brain damage. Seasonal pregnancy care. Summer. Maternity clothes have come a long way nowadays and should be wholeheartedly opted for. Make sure you buy clothes that cool you off by making you look and feel great. Monsoon. Keep your skin hydrated at all the times and bath daily to fight against high humidity levels in monsoon. Apply homemade creams, rose water and soothing oils and lotions to the areas where you might feel you are getting stretch marks. Winter. Eat a fruit diet as it helps in developing a robust immunity level. Keep yourself hydrated enough by drinking healthy liquids such as water, homemade soaps, and green teas. Stay away from drinking too much coffees, black teas, etc.
Thank you. Please like, share, and subscribe to the channel. Click on the bell icon for important notifications and videos.